Hello, everyone. Welcome to today's lecture on pulmonary function tests. We're going to dive into understanding the procedure and the nursing implications surrounding these essential diagnostic tools. Now, I know some of you might be thinking, pulmonary function tests sounds like a bunch of hot air, but trust me, these tests are a breath of fresh air when it comes to diagnosing and managing respiratory disorders. As nurses, you'll be caring for clients with a wide range of respiratory conditions. Mastering the knowledge of pulmonary function tests will not only help you ace your exams, but also make a significant impact on your patients' lives. So take a deep breath and let's get right into the fascinating world of pulmonary function tests. Remember, every breath counts, and so does every minute of this lecture. Let's look at the objectives for this presentation. You're going to understand the purpose and indications for pulmonary function tests. You'll be able to describe the procedure for pulmonary function tests. You'll discuss nursing interventions before, during, and after the procedure. Explain client education about the procedure. Interpret the findings of pulmonary function tests and identify potential complications and nursing interventions to address them. Now that we've set our objectives for today's lecture, let's explore an overview of pulmonary function tests. Picture your lungs as two inflatable balloons that work around the clock to help us breathe. They expand and contract, taking in the oxygen we need and expelling the carbon dioxide that we don't want. But what if these balloons aren't performing as efficiently as they should? That's when pulmonary function tests, or PFTs, come into play. PFTs are non-invasive diagnostic tests that assess how well the lungs are functioning. They measure various aspects such as lung capacity, volume, gas exchange, and airflow rate. Think of PFTs as a comprehensive health checkup for our lung balloons, providing essential information to guide healthcare providers in diagnosing, treating, and monitoring respiratory conditions. As we venture further into the world of pulmonary function tests, we'll discuss some of the common types of PFTs you might come across in practice. Picture these tests as different tools in a toolbox, each designed to assess a specific aspect of lung function. First up, we have spirometry, which measures the amount and speed of air you can inhale and exhale. Imagine trying to blow out all the candles on a giant birthday cake in one breath. That's a bit like what spirometry measures. This test helps us to identify any obstructive or restrictive lung diseases. Next, we have lung volume tests, which assess the size of the lungs and how much air they can hold. Think of it as measuring the capacity of our lung balloons. Then there's the diffusion capacity test, which evaluates how efficiently our lungs exchange gases, like oxygen and carbon dioxide. It's like checking how quickly our lung balloons can take in the good stuff and release all the bad stuff. And finally, we have bronchial provocation tests, which determine how sensitive the airways are to various stimuli. This test might remind you of an allergy test because it helps us to identify triggers that cause the airways to narrow. Pulmonary function tests encompass a wide range of tests designed to assess the functioning of our lungs. Let's look again at some of the most commonly performed lung function tests and look at now their specific purposes along with examples. So again, let's look at spirometry. This is a fundamental lung function test that measures the amount of air the lungs can hold, known as lung capacity, and how forcefully one can expel air from the lungs. This test is crucial for screening various lung diseases. For example, it is used to diagnose restrictive lung diseases like pulmonary fibrosis or sarcoidosis that affect lung volumes, as well as diseases impacting the airways, such as chronic obstructive pulmonary disease or asthma. Our lung volume testing is a more precise test than spirometry, and our lung volume testing measures the volume of air in the lungs, including the residual volume. That is the air that remains at the end of a normal exhalation. This test is particularly helpful for identifying and evaluating the severity of restrictive lung diseases like interstitial lung disease, providing valuable information to guide treatment plans. The diffusing capacity test evaluates how efficiently oxygen enters the bloodstream from the lungs, and this is essential for diagnosing conditions like interstitial lung disease, emphysema, or pulmonary hypertension. In these conditions, gas exchange between the lungs and the bloodstream may be impaired, leading to decreased oxygen levels in the blood. Exercise testing, such as the 6-minute walk test or cardiopulmonary exercise test, assesses the causes of shortness of breath during physical activity. It helps healthcare providers understand a patient's exercise capacity and identify underlying respiratory issues like exercise-induced bronchoconstriction or cardiovascular problems such as heart failure that may contribute to these symptoms. And then for asthma tests, when standard breathing tests are normal, but a healthcare provider suspects asthma, additional tests like a methacholine challenge or a bronchial provocation test may be performed to determine if asthma is present. These tests help to identify bronchial hyperresponsiveness, a characteristic feature of asthma, and guides appropriate treatment strategies. You need to understand the purposes and indications for each specific lung function test so that you can anticipate and prepare for patient needs. Now that we've covered the various types of pulmonary function tests and their purposes, let's focus on the procedure for spirometry, one of the most common tests, and the nursing interventions related to it. So your pre-test preparation will be to educate the patient about spirometry, explaining its purpose and the process involved. Ensure that the patient follows any pre-test instructions, such as withholding certain medications, such as bronchodilators, avoiding smoking, and refraining from consuming large meals for at least 2 hours prior to the test. Tell the patient to wear loose, comfortable clothing that won't restrict their breathing during the test. You've got some equipment set up. You need to set up the spirometer and ensure it's properly calibrated and functioning. Provide the patient with a disposable mouthpiece to minimize the risk of infection transmission. You'll need to position the patient. Seat the patient upright in a comfortable chair with their feet flat on the floor. This position optimizes lung function and ensures accurate results. To perform the test, instruct the patient to take a deep breath. Place the mouthpiece in their mouth and seal their lips around it. Then ask them to exhale forcefully and as quickly as possible into the mouthpiece. They should continue exhaling until they've emptied their lungs completely. The test may be repeated several times to obtain the most accurate results. Client education. You need to encourage the patient to take their time and follow your instructions closely during the test. Reassure them that it's normal to feel slightly breathless after exhaling forcefully, but if they feel dizzy or lightheaded, they need to inform you immediately. After the test, once the test is complete, allow the patient to rest and recover their normal breathing pattern. Monitor them for any signs of respiratory distress, lightheadedness, or chest discomfort, and then discuss the results with the patient and provide any necessary follow-up instructions or recommendations. We need to understand the spirometry procedure and implement appropriate nursing interventions to ensure that the test is performed accurately, safely, and comfortably for our patients. Now let's focus on the procedure for lung volume testing, another common test, and the nursing interventions related to it. Again, you're going to educate the patient about lung volume testing, explain the purpose and the process involved, and once again, they have to follow pre-test instructions such as withholding medications like bronchodilators, not smoking, and refraining from consuming large meals at least 2 hours prior to the test. Once again, inform them to wear loose, comfortable clothing that won't restrict their breathing during the test. For the equipment setup for this, you're going to need to set up a plethysmograph. This is a specialized device for measuring lung volumes or any other equipment required for the specific lung volume test being performed, and ensure that they're properly calibrated and functioning. You're going to seat the patient upright in a comfortable chair with their feet flat on the floor. If you're using a plethysmograph, instruct the patient to enter the body box and sit comfortably. This position optimizes lung function and ensures accurate results. Now you need to instruct the patient to place the mouthpiece in their mouth, seal their lips around it, and breathe normally. For a plethysmograph test, the patient will be asked to breathe against a closed shutter in the mouthpiece, and this will create changes in pressure inside the box. The equipment will then measure the lung volumes based on these pressure changes. The test may be repeated several times to obtain the most accurate results. Encourage the patient to relax and follow your instructions closely during the test. Once again, remind them this test is non-invasive, it should not cause any pain or discomfort, and if they feel any difficulty breathing, they need to inform you immediately. After the test is complete, allow them to rest and recover their normal breathing pattern. Monitor them for any signs of respiratory distress, lightheadedness, or chest discomfort. Discuss the results with the patient and provide any necessary follow-up instructions or recommendations. You need to understand the lung volume testing procedure so that you can implement appropriate nursing interventions, ensure the test is performed accurately, safely, and comfortably. This is crucial in diagnosing and managing restrictive lung diseases and helps to guide the most effective treatment strategies. Now that we've looked at spirometry and lung volume testing, we're going to move on to diffusing capacity test. This test measures how well the lungs exchange gases, and this is crucial as the primary function of the lungs is to allow oxygen to diffuse into the blood and carbon dioxide to diffuse from the blood into the lungs. So let's break down this procedure and the nursing interventions associated with it. Before the test, you need to educate the patient about the diffusing capacity test, its purpose, and the process involved. Remind them once again to follow any pre-test instructions, avoid heavy meals, don't smoke for at least 4 to 6 hours before the test, and check with their healthcare provider about whether they should be using bronchodilators or any other inhaled medications prior to the test. Advise them to wear loose, comfortable clothing because, again, you don't want them to restrict their breathing during the test. Ensure the appropriate equipment such as a spirometer and gas analyzer is properly set up, calibrated, and functioning. Seat the patient upright in a comfortable chair with their feet flat on the floor because this optimizes lung function and ensures accurate results. Instruct the patient to place the mouthpiece in their mouth, sealing their lips around it, and breathe in air that contains a very small amount of carbon monoxide and a tracer gas, such as methane or helium. They need to hold their breath for 10 seconds and then exhale rapidly. The exhale gas will be tested to determine how much of the tracer gas was absorbed during the breath. Nose clips will be used to ensure that no air escapes through the nostrils. Encourage the patient to relax and follow your instructions closely during the test. Reassure them the test is non-invasive and should not cause any pain or discomfort. If they experience any difficulty breathing or any discomfort, they need to inform you immediately. After completing the test, allow the patient to rest, return to normal breathing patterns, monitor them for any signs of respiratory distress, lightheadedness, or chest discomfort, and discuss the results with the patient and provide any necessary follow-up instructions or recommendations. Again, we need to understand this test in order to implement appropriate nursing interventions, ensure it's performed accurately, safely, and comfortably for our patients. And this information is essential in diagnosing conditions where gas exchange between the lungs and the bloodstream might be impaired. So this was going to help guide the most effective treatment strategies. Now let's move on to exercise testing. This evaluates the causes of shortness of breath during physical activity. It's going to help us as healthcare providers understand a patient's exercise capacity and identify any underlying respiratory or cardiovascular issues that might be contributing to their symptoms. So here's a breakdown of the procedure and the nursing interventions associated with exercise testing. Before the test, educate them about the exercise test, its purpose, and the process involved. Remind them to wear comfortable, loose-fitting clothing and appropriate footwear for the test. Make sure they follow any pre-test instructions given by their healthcare provider, such as medication adjustments or dietary restrictions. Then you need to set up the appropriate equipment for the test, such as a treadmill, a stationary bicycle, or other exercise equipment, as well as monitoring devices like a pulse oximeter, an ECG, and a blood pressure cuff. Before beginning the test, obtain baseline measurements of the patient's heart rate, blood pressure, and oxygen saturation levels. Then instruct the patient to begin exercising on the selected equipment at a low intensity. Gradually increase the intensity of the exercise based on the testing protocol or until the patient reaches their target heart rate, experiences significant symptoms, or is otherwise unable to continue. Continuously monitor the patient's heart rate, blood pressure, and oxygen saturation throughout the test. Encourage the patient to communicate any symptoms or discomfort they experience during the test, such as chest pain, dizziness, or shortness of breath. Remind them that they can stop the test at any time if they feel unwell. After completing the test, allow the patient to cool down with a period of low-intensity exercise or rest. Continue to monitor their vital signs until they return to the baseline levels. Discuss the results of the exercise test with the patient and provide for any necessary follow-up instructions or recommendations. Reinforce the importance of reporting any new or worsening symptoms to their healthcare provider promptly. By understanding the exercise testing procedure and implementing appropriate nursing interventions, again, we can help to ensure that the test is performed accurately, safely, and comfortably for our patients. The information gathered from exercise testing is valuable to identify the causes of shortness of breath and to help guide the most effective treatment strategies. Now let's discuss asthma testing, specifically the bronchial provocation test, which is performed when standard breathing test results are normal, but there's still a suspicion of asthma. Bronchial provocation testing, such as a mannitol challenge test or a methylcholine challenge test, helps to identify bronchial hyperresponsiveness. This is a characteristic feature of asthma, and we need to guide appropriate treatment strategies. So here's an overview of the procedure and the nursing interventions related to the bronchial provocation test. Before the test, inform the patient about the purpose and process of the challenge test. Ensure they follow any pre-test instructions given by their healthcare providers, such as withholding certain medications or avoiding caffeine for several hours before the test. Before beginning the test, the patient will be seated upright in a comfortable position. Obtain baseline spirometry measurements to assess the patient's lung function. This will involve performing standard spirometry 3 times. Then explain the procedure of inhaling set doses of mannitol powder or methylcholine and performing forced expiratory volume in 1 second. This is an FEV1 maneuver to measure the dose response of the mannitol on the laboratory spirometer. The patient will be wearing a nose clip and will be instructed to breathe in the mannitol powder at certain intervals. For monitoring, you need to continuously monitor the patient's heart rate, blood pressure, and oxygen saturation levels throughout the test. Reassure the patient and remind them to report any symptoms or discomfort they experience, such as chest tightness, coughing, or wheezing. To follow up, you're going to perform spirometry measurements at certain intervals after each inhalation step because we want to assess any changes in lung function. If the patient's lung function decreases significantly, this may indicate bronchial hyperresponsiveness. The test may be stopped. Once the test is complete, administer a bronchodilator medication to reverse any bronchoconstriction that occurred during the test. Reassess the patient's lung function after the bronchodilator is administered. The physician will explain the results of the challenge test to the patient in detail. Provide any necessary follow-up instructions or recommendations, such as starting or adjusting asthma medications. Emphasize the importance of adhering to their asthma management plan and seeking medical attention for any worsening symptoms. We need to understand the bronchial provocation test challenge and implement appropriate nursing interventions so that we can ensure this test is performed accurately and safely. Very important that we have that bronchodilator medication handy in case of severe bronchoconstriction. And it's going to provide valuable information to identify and manage asthma effectively. As nurses, we play a crucial role in supporting our patients through this very challenging testing process and helping them to manage their respiratory condition. Interpreting the findings of various pulmonary function tests is essential to guide appropriate care and treatment for our patients. So let's discuss the differences between normal and abnormal results for each test we've covered. Normal spirometry results indicate that the patient's lung function is within the expected range for their age, sex, height, and ethnicity. Abnormal results may show obstructive or restrictive patterns. Obstructive patterns, such as reduced FEV1-FVC ratio, this is the ratio of the forced expiratory volume in 1 second divided by the forced vital capacity. And remember that forced expiratory volume in 1 second is the amount of air you can exhale in 1 second. And forced vital capacity is the maximum amount of air you can forcibly exhale from your lungs after fully inhaling. Anything that is decreased in this is indicative of airway diseases like asthma or COPD. Restrictive patterns such as reduced lung volumes suggest lung parenchyma or chest wall disorders. So for lung volume testing, normal results reveal lung volumes within the expected range, and abnormal results may indicate restrictive lung diseases such as pulmonary fibrosis or chest wall deformities, and these reduce lung capacity and restrict the patient's ability to breathe in sufficient air. A normal diffusing capacity indicates that oxygen is effectively transferring from the lungs to the bloodstream. Abnormal results, such as a reduced diffusing capacity, may suggest conditions like interstitial lung disease or emphysema. These are conditions where gas exchange is impaired. For the exercise testing, normal results indicate that the patient's heart rate, blood pressure, and oxygen saturation levels remain within the expected range during exercise. Abnormal findings such as exercise-induced desaturation or abnormal heart rate response may suggest respiratory or cardiovascular disorders that are contributing to shortness of breath. And the asthma test, the bronchial provocation test, normal results indicate no significant decline in lung function after inhaling the mannitol or methacholine. And this suggests that asthma is unlikely. But abnormal results, such as a significant decline in lung function or bronchial hyperresponsiveness, this indicates a high likelihood of asthma with ongoing airway inflammation. So you need to understand and interpret the findings of these pulmonary function tests so that we can guide our patients' care and treatment plans. As nurses, we play a vital role in assisting healthcare providers in determining the most appropriate interventions and management strategies for our patients with respiratory disorders. We're the ones who have eyes on the patient, and we can tell the provider how they are responding to the different treatments that the provider orders. Now, while pulmonary function tests are generally safe and well tolerated, there are potential complications that can arise during or after the test. So it's essential to be aware of these complications and be prepared to address them promptly. Let's talk about some. How about hyperventilation? That's rapid or deep breathing during testing, especially spirometry, and this can cause the patient to hyperventilate. This can lead to lightheadedness, dizziness, or even fainting. If you notice a patient showing signs of hyperventilation, stop the test. Encourage slow, deep breaths, and ensure the patient is seated or laying down until their breathing returns to normal. Bronchospasm. Tests like bronchial provocation testing or exercise testing may trigger bronchospasm in patients with asthma or other airway diseases. Be prepared to administer a short-acting bronchodilator to relieve the bronchospasm and monitor the patient closely for any worsening of symptoms. Also, there could be chest pain or shortness of breath. Patients may experience chest pain or shortness of breath during exercise testing or other lung function tests. If this occurs, stop the test immediately. Assess the patient's vital signs, administer oxygen if needed, and notify the healthcare provider for further evaluation. Some patients may experience anxiety during pulmonary function testing, particularly if they feel claustrophobic or have difficulty breathing. Provide emotional support, offer clear instructions, and reassure the patient throughout the test. Encourage relaxation techniques such as deep breathing or visualization to help reduce anxiety. As nurses, we've got to be proactive in addressing these complications to ensure our patient's safety and comfort. Remember, if a patient experiences hyperventilation, have them take slow, deep breaths, not fast, deep breaths, and maintain a seated or lying position until their breathing normalizes. Monitor their vital signs. Provide reassurance to help ease any anxiety. In the event of a bronchospasm, administer a prescribed short-acting bronchodilator, such as albuterol, and monitor the patient's response. Assess lung sounds, vital signs, and oxygen saturation, and notify the healthcare provider if symptoms do not improve or if they worsen. If a patient reports chest pain or shortness of breath during the test, immediately stop the test, assess their vital signs, administer supplemental oxygen if needed, and notify the healthcare provider for further evaluation and management. And to manage anxiety, provide emotional support and clear instructions throughout the test. Encourage the patient to use relaxation techniques such as deep breathing or visualization to help reduce anxiety. Remain attentive and responsive to the patient's needs and concerns. So we've reached the end of our journey through pulmonary function tests. Let's do a quick recap of what we learned. We covered the various types of pulmonary function tests, such as spirometry, lung volume testing, diffusing capacity tests, exercise testing, and asthma testing, as well as their specific indications and purposes. We looked at the detailed procedures for each test, including necessary patient preparation, the steps involved in performing the test, and critical nursing interventions needed before, during, and after the test. We explored the interpretation of test findings, differentiated between normal and abnormal results, and looked at how these results inform the diagnosis and management of respiratory disorders. And finally, we discussed potential complications and associated nursing interventions, ensuring that we're well equipped to manage any issues that may arise during these tests. Remember, as nurses, our understanding and proficiency regarding pulmonary function tests are vital to provide the best possible care for our patients with respiratory disorders.